Welcome to the forum. The comments and opinions of guests and callers are not necessarily the opinions of KMOG.
Welcome to Rim Country Forum. I'm Payson Jason, your Saturday host on the forum. We visit with special guest Dr. Weyrich this morning. He's naturopathic medical doctor. You can call him at 888-391-0414, or you can see online his website at drweyrich.com. That's drweyrich.com. Thanks for being here this morning, Dr. Weyrich.
Yes, it's great to be back.
Yeah, and let's see, you were host for almost a year, I think, here on the evening show we had, 5 p.m. Was it Tuesdays?
Yes, Tuesdays with Dr. Gear, and I was sort of his sidekick.
Yeah, you filled in for a little while there as well.
Yes. Yeah,
I didn't get a chance to meet you, so it's good to meet you, Dr. Weyrich.
Well,
I did get to listen, so I enjoyed the show. I thought you did a really good job. Maybe it'd be good to tell everybody a little bit about yourself.
Okay, before I tell about me, let's talk about what I'm going to talk about today.
Yes, please.
So, first thing on my agenda is going to be to introduce myself, but then I'm going to talk about fibromyalgia as a problem case that a lot of people suffer from, and I've got relatively good evidence for some treatments that involve something called low-dose naltrexone.
Okay.
And then I'll do a very brief case study of one of the patients that I had that had fibromyalgia and some other complaints that I treated with low-dose naltrexone. Then I'll start talking about what actually is low-dose naltrexone, what's its history, how safe is it, how effective is it, and then we're going to really go into what I think is going to be a really great segment of the show. We're going to talk about long-haul COVID and also something called Post-vax Syndrome. And Post-vax Syndrome is basically the problems that people seem to have that are being blamed on side effects of the vaccination.
Oh, okay.
And for a long time, we haven't been able to talk about that because basically any discussion that went against the mainline narrative was basically suppressed.
There was a long denial that there was a post-vax syndrome.
Yes, and even today, a lot of the information I'm going to be sharing comes out of England. It doesn't come out of the United States because, again, the suppression of the other side of the story, or the rest of the story, as Paul Harvey used to say, it's really been bad for science and also bad for democracy that one side of a discussion is suppressed.
There hasn't been any funding for any research. There's a denial that there was even an issue.
Right. And those research scientists that stepped up and tried to say, hey, let's talk about this,
now,
they were defunded.
Long-haul COVID and post-vax syndrome, are they related, or are they two sides of a coin?
Well, in the one case, the long-haul COVID is what happens after you have had the actual virus and recovered, whereas the post-vax syndrome is very similar in many ways to the long-haul COVID, but you didn't have COVID. Instead, you had the vaccination, and in both cases, the body's immune system gets messed up, and we're left with, what do we do now? And so I'll be talking a little bit about what we do now.
And we'll get to find out a little bit about how the LDN works. Could you say that again? Low-dose naltrexone?
Low-dose naltrexone.
Low-dose naltrexone.
And so I'll be talking about the history of naltrexone and the low-dose naltrexone and how safe is it, how effective is it, and how it works. Very briefly, my wife was reading over my notes for the show today, and she said, you really need to talk about how it works. And I said, I only have an hour. I can't. What you are asking for is a graduate level course of a whole semester. And so I'm going to be very terse, but I do have a lot more information on my website than what I'll be able to share tonight. And so most of the things that I make statements about, I can't give you the footnotes, but if you go to my website, in many cases I do have the footnotes that tells where in the peer-reviewed literature I got these ideas.
And that's drweyrich.com.
Right, drweyrich.com. Weyrich.com. And if you just put that into the address bar at the top of your browser, you'll pop right in. If you try to type it into the Google search bar, I'll be there somewhere, but they tend not to rank me very highly. But if you put it directly into the address bar, I pop right up.
Oh, okay. Okay, well, your PhD and NMD, that's
yes.
naturopathic medical doctor?
Yes.
And you've been a doctor for 20 years?
I graduated in 2007 with my naturopathic medical degree.
Okay, from?
Southwest College of Naturopathic Medicine in Tempe, now called Sonoran University.
Oh, okay. Locally educated.
Yes, it's one of about, at the time it was one of about 6 naturopathic medical schools in North America.
Oh, wow, okay. That study has become much more popular than since 2007.
It has. It's been growing.
Yeah. And have you practiced here in Payson since you graduated, or?
I practiced in Phoenix and Scottsdale from 2007 to the present. I started up here in Payson when Dr. Gear got involved up here in Payson. I became involved in 2014.
Okay.
Previously, I was working with Dr. Gear in Phoenix. He was one of my teachers when I was in medical school. And so I just kind of tagged on after I graduated. But
very interesting. Are you accepting new patients?
I am accepting new patients. Okay. And the phone number is 888-391-0414. And that rings on my desk. And it also will go to an answering machine if I'm not at my desk or I'm otherwise occupied. But please leave a message. I do check my messages frequently. I have it set up so that when I get a message that's left on my answering service, I get an email telling me, hey, you've got a new voicemail. And so I really, if you want to get in hold of me, call the 888-391-0414 number.
And that's for phone consultations and or making appointments.
Right. I'll be happy to talk about your situation. And if I think that I can help you, I'll tell you and I'll try to make an appointment. If I hear what your concerns are and I say, gee, I think you really need to see another kind of doctor, I'll tell you that too. I don't want to waste your time. I don't want to waste your money. I want to help the people that I can help. And so it's very important to me to be able to have these conversations over the phone.
One of the things I asked earlier before we went on was about your history. Was you studied chemistry? Is that right?
Yes, I have a PhD in organic chemistry from the University of Tennessee in Knoxville.
PhD in organic chemistry, and that really, I suspect, really helps out your understanding of
yes.
and your ability to apply naturopathic medicine.
Yes, so I'm well trained in the biochemistry of how the body works, which is really the physiology of the body, how the body works. Mm-hmm. And so that's where I really understand what's going on at a very deep level. And then I try to do an impedance match, if you will, to make it real for the patient sitting in front of me who obviously doesn't have a PhD in most cases, although I do have some very highly educated patients as well.
Sure. One of the things you wanted to talk about was fibromyalgia. Is that something you find you've got some successful treatments for patients with fibromyalgia?
Yes. So fibromyalgia is one of these syndromes that the doctors diagnose when they can't figure out anything else that's wrong. So it's sometimes called a wastebasket diagnosis. If can't figure out anything else, can't find any other real problem, then, hey, it must be fibromyalgia.
Do people with fibromyalgia have pain? Is it noted by pain?
Yes.
What are the symptoms?
Okay, so myalgia is a fancy word for pain.
Okay.
And fibro is a fancy word for muscle. And so fibromyalgia is characterized, number one, by pain throughout the body that is in the tissues, not the joints.
Aha.
And it tends to move around, but it's also associated with other symptoms such as severe fatigue, chronic fatigue, and brain fog. So those are the hallmark symptoms of fibromyalgia.
Those are also symptoms of the long haul COVID too. Are they
Bingo.
Not? Aha. Okay.
And so if we look at the longer history of treating fibromyalgia, we get good ideas about how to treat long haul COVID and vax injury, which again has similar issues. And since fibromyalgia has been around a lot longer, we have more information about what to do with it, do about it.
Now, the COVID was a virus.
Yes.
Okay. And some of the treatments were antiviral medications.
Yes.
What they're studying, is it antiviral medications or what are they?
Okay, so what I'm going to talk about with low-dose naltrexone is not directed against the virus so much as it is directed towards helping the immune system respond appropriately. A lot of the problems, especially in the early days of the COVID pandemic, was that the doctors didn't know how to deal with this novel new creation of a Chinese lab. And they didn't always do the right things. They did the best they could. But yes, it is a virus. And yes, there are some antiviral treatments that are available now, but they're not so much effective at treating the long COVID or the vax injury. They're more aimed towards mitigating the acute phase where you're in the hospital in a worst case scenario.
Okay, initially upon the COVID pandemic, the response, there was basically we had the vaccine, which was not necessarily an antiviral drug.
Well, the vaccine was directed directly at the virus.
Okay, and there was two types of vaccines as well.
Actually, three.
There was three types.
Yes,
okay.
Johnson & Johnson, Moderna, and the Pfizer. The Pfizer is the most common.
Okay, I don't know why. I thought Pfizer and Moderna were very similar, if not the same.
All three are similar in that they all act on what's called the spike protein. So any vaccine, going all the way back to the very first vaccine, which was smallpox, gives to the body something that sort of looks, feels, tastes, and smells like the real disease-causing agent,
to
virus.
Activate your natural antibodies.
And, yes, to activate your natural immunity.
Okay.
But you want the immune system to see something that's close enough to the real thing that it learns to fight against it, but not so close that it causes disease itself. And unfortunately, the vaccines that were developed were close but no cigar, so far as they were very good at introducing the immune system to the virus, or the signature of the virus, but too close to the virus in some ways, which seems to have caused more side effects.
Oh, okay.
And
is it common with all three vaccines, or was it more common with certain vaccines?
I think that it's a problem with all three.
Okay.
The Johnson & Johnson was the most evident soonest. And so people backed off on using the Johnson & Johnson.
There was reports of heart issues, I think.
Yes,
okay.
Which is common to all the vaccines. As well as if you get COVID, you have heart sequelae as well.
Oh, okay. So it could be whether you got COVID or whether you had the vaccine, it's been trouble on people's heart. I see.
Yes. So long-haul COVID, one of the main problems is pulmonary cardiovascular symptoms, shortness of breath, clotting, causing cardiac events, and so forth. So that's common to both being exposed to the real deal or being exposed to one of the vaccines.
So you've got some case studies and testimonials. Is this regarding the use of low-dose naltrexone for everything from fibromyalgia to long-haul COVID and the post-vax syndrome?
Well, I don't personally have that many case studies on low-dose naltrexone per se. But especially on my website, I have a big, long list of different conditions that there are case studies that show that low-dose naltrexone is very effective. But fibromyalgia is one of the more studied different problems that low-dose naltrexone helps. And so let's talk about one study that has been published that I wanted to talk about today, and it's more details are on my website. So we had what's called a randomized double-blind placebo-controlled study, which is the gold standard of research. Doctor doesn't know whether the patient is being given a placebo or the real drug being tested. Patient doesn't know, and it's random. A third party knows who got what, but the doctor and the patient don't know. And they're giving placebo versus the active substance, and they look to see whether there's a difference between placebo and the real deal. Because actually, if you take a group of people and give them a sugar pill, 10-20% of them will say, hey, that's a great stuff. I feel better.
They feel better, right.
But that's a placebo effect. So you have to prove statistically that the real deal is really better than just people believing that they got the real deal.
That makes sense. So you've got pretty good case studies that are legit.
Well, they're legit. They're published in the peer-reviewed literature, but they're relatively weak because here's the rub. Low-dose naltrexone was licensed by the FDA in 1984. It is long out of patent and is a generic drug now, meaning it's very cheap. Good for the patient, but unfortunately not good for pharmaceutical companies. And so they don't want to spend the big bucks that it takes to get FDA approval of this drug that they can't patent.
To treat these
things. So we have to rely on small groups of studies, doctors doing case studies and documenting what they did and what the results are and things like that. So it is evidence. It is evidence-based medicine. And by the way, if you study evidence-based medicine, a case study is considered to be more evidence than a expert opinion, in air quotes.
The low-dose naltrexone, a patient who's prescribed that, what do they go through? Are they taking 3 doses a day? Is it these low doses?
It's low dose.
How long do they take it for?
As long as they need it. Some patients respond in the first week, and after 2 months, we can cut it, and they're good to go for the long term. In some cases that I've got documented, patient after 18 months, every time they tried to take away the low-dose naltrexone, they reverted. But hey, if you can take a pill that has virtually no side effects once a day that costs $30, $40 a month and get away from the effects of long-haul COVID or Post-vax Syndrome, then it's a no-brainer. Let's do it.
Yeah, so the long-haul COVID and the Post-vax Syndrome and the fibromyalgia are all very debilitating.
Yes, they are.
Okay. We're going to talk a little bit more about how the low-dose naltrexone works. Let's take a break, and we'll be back and find out more about how the LDN works.
Okay, fantastic.
All right. More to come on Rim Country Forum with Dr. Weyrich. That's 888-391-0414. You're listening to Rim Country Forum on KMOG. We're visiting with Dr. Weyrich. He's a naturopathic medical doctor. I wanted to talk a little bit about how the LDN works, but also I know the CDC just announced new COVID guidelines just yesterday. Maybe you could help explain that to some of our listeners who might have concerns or...
Yes. So briefly, I haven't actually read the details. I picked up the news blurb that they had released it, but it seems like the CDC is saying basically, hey, the pandemic is over, stand down. Here are the current scientific-based recommendations going forward, and so they've taken away a lot of the lockdown-type features.
Seems like they had a 5-day, after you test positive, there was you had to wait 5 days to go back to work or something?
Right. You were considered to be infective for 5 days after you got symptoms.
I believe the new COVID guidelines are once you feel better and you're no longer feverish.
I haven't read. But just as an aside, I used to teach at one of the Maricopa County community colleges. And long before the COVID pandemic started, I was teaching microbiology class, and I did a sort of a class participation case study kind of thing. Hey, we've got this new virus, and we don't have enough vaccine to go around. What should public health do? And we basically talked about the COVID scenario, and the conclusion that I was trying to guide the class towards was lock down the vulnerable people, isolate them to protect them, give whatever vaccine is available to the first responders that are most exposed, but also most likely to carry the virus to other people, and otherwise go about your business. And so that's what I recommended 5 years ago, more or less. And that's pretty much what current scientific consensus is, although the CDC and it's the executive branch that controls the CDC are very slow to bring that in. And it looks like we have a caller.
We do. Let's get to the phones. Caller, welcome to the forum. Thanks for your call. You're on with Dr. Weyrich.
Yes, good morning to both of you.
Morning.
And hello, Dr. Weyrich in particular. This is Chris Peebles, and I wanted to ask you about naltrexone's use. I noticed on some of the information that it might even be helpful for cancer patients as well as Parkinson's patients. And I'm amazed that one drug has multiple benefits or has benefits against multiple conditions, and that suggests some underlying similarity among those conditions that it's addressing. But that's another story. Do you have something that you can share about either prostate cancer or Parkinson's related to low-dose naltrexone?
Best I can say in the time available is I've got a lot of information on especially cancer on my website. It is very effective in benefiting a wide variety of different types of cancer. And yes, it also benefits in general neurodegenerative diseases, neuroinflammation diseases, of which Parkinson's and Alzheimer's are good examples. And again, that's on my website. I don't have all the details in front of me, but let's talk about the mechanism just a little bit.
Please. Thank you.
It really comes down to our cells of our body have what are called receptors.
Yes.
And we have receptors for thousands of different things that float around in the blood. And we have mu receptors, which, for example, are the receptors that are most stimulated by opiates. And the mu receptors react with the opiates that people might take as a pill, but they also react to inborn pseudo-opiates called endorphins and alkalpins. Yeah. And those are part of the way we're wired.
You said those are pseudo-receptors?
No, they're receptors, but they're not innately designed in our body to react to opiates. They are made to respond to internal chemicals that are made that are similar to opiates in their effect on the receptors. And that's part of our body's innate ability to control pain, for example. So that's the mu receptor. Naltrexone blocks that mu receptor, which means it's an antidote like Narcan for opiates. So it's an anti-opiate. And that's the way it was originally licensed by the FDA, as an anti-opiate, an opiate antagonist, as they say.
So my thought is, and I'm just curious if you have any, how would I say it, information or even a thought process that would relate to, since the neurotransmitter receptor sites are suppressed, that would affect anxiety and possibly cortisol release. And that could be a common factor. I don't know. What do you think?
Well, a lot of research has gone into this. Again, I can't talk about it all here, but let me introduce a couple other ideas, and then I'll come back to you. So there are other receptors that naltrexone seems to stimulate. And in particular, there are toll-like receptors, which is part of our immune system, that recognize various things in the environment and control our immune response.
Wow, that's fascinating. I hadn't heard that aspect.
And so the low-dose naltrexone at very low doses it tickles these toll-like receptors. And there's a number of different toll-like receptors, given numbers like 4, 7, 9, and so forth. And I'm still reading all the details. There's still more to learn, but it's pretty clear that low-dose naltrexone does tickle these receptors that control the immune system. And that's how it exerts a lot of its benefits, including its effect against long COVID, fibromyalgia, Parkinson's, and so forth. Multiple sclerosis is one of the very most studied of all of the neurodegenerative diseases that low-dose naltrexone benefits. But then there's a third kind of receptor called the opiate-like growth factor receptor, and that has an effect on cancer. Low-dose naltrexone blocks this receptor that seems to control the growth of cancer. And if this receptor is not blocked by low-dose naltrexone, the cancer cells tend to proliferate. But if low-dose naltrexone is blocking that, then the cancer cells don't grow as avidly and gives the immune system more time to deal with the cancer cells. So that's, in a nutshell, how low-dose naltrexone works.
Well, I have a question. And if your time is up, that's fine. I can make an appointment with you. But my question is, do you prefer or use oral versus injected low-dose naltrexone?
Normally it's oral, but there are other preparations. It's used to treat, in some cases, autism. And some of these autistic kiddos don't particularly tolerate oral medications, but they can apply it as a topical cream and get benefit.
Wow. Also, I noticed that it was originally approved for 50 to 200 milligrams a day, I believe. And
Yes.
Some of the reports here show dosages as low as 5 milligrams a day can be effective.
Or even lower. And
Wow.
it has to be individualized. So normally, depending on the individual, I start with the original protocol would start with 1.5 milligrams. After a couple weeks, bump up to 3 and then go up to 4.5. But
when they say low dosage, they mean low
yeah,
dosage.
it's less than 10% of what is already been established by the FDA as being safe. So the big limitation of low-dose naltrexone is we don't have as good of evidence of efficacy. It's case studies, which some people dismiss as being anecdotes or anecdotal evidence. So it's not all the gold-plated, double-blind, placebo-controlled studies, but it is considered evidence, and in the hierarchy of evidence, it is more important to have case studies than it is to have experts who have opinions.
Mm-hmm. And with such low doses, little to no side effects reported.
Right. A very few side effects with full-dose naltrexone. The only real contraindications for low-dose naltrexone are you can't take it if you're on opiates because it will introduce withdrawal or make the opiates not work.
There's a conflict.
With
the receptors.
Right. And
The
another
receptors.
and another thing that you can't use with low-dose naltrexone is we need to stay away from people that have organ transplants that are taking all these drugs to modify the immune system. The doctors that are trying to keep the patient alive, keep them from rejecting the organ transplant, don't want me or any other doctor messing with the immune system. So we have to stay away from those people. And otherwise, it's very well tolerated. Some people have vivid dreams if they take it too late in the day, but by adjusting the dose and the time of the dose, we generally can work our way around those problems.
I have one question about making an appointment, and then I'll let you go so that other callers can get in. If I want to make an appointment, how long of a time delay is usually required? Can I make an appointment a few days in advance or a week in advance, or what do you suggest?
Well, call me and express your interest, and I try to cluster. I have two offices, one in Scottsdale and one in Payson, and I try to cluster so that I have a full day of patients when I come up to Payson. It's a long drive for me from Scottsdale, so let me know.
I probably prefer the Scottsdale one. I have family in the area.
Yes, generally speaking, I have same week or next week availability depending on what time of the week you call me.
Okay, excellent. Well, thank you for your help. Appreciate your information and look forward to speaking with you more on this.
Well, thanks for.
And we're visiting with Dr. Weyrich. He's naturopathic medical doctor practicing here in Payson. And again, you can reach Dr. Weyrich at 888-391-0414. More coming up on Rim Country Forum. We're visiting with Dr. Weyrich, and we've been talking about low-dose naltrexone and its many uses for treating your immune system, chronic fatigue, and other ailments, including cancer. You can prescribe it to cancer patients, I guess, as well.
Yes, right now I'm still engaging in medical education to fully understand the naturopathic approach to cancer before I dive into prescribing low-dose naltrexone for cancer, but it is very effective. But these very complex, high-risk kind of diseases, I like to make sure that I'm well prepared before I dive in. And so I'm still in the student phase of learning everything I feel I need to know before I venture into these areas. But I'm very confident with dealing with something like long COVID.
You've had positive case studies for people suffering from anything from rheumatoid arthritis to other types of disease and issues? What, mixed connective tissue disease or other issues?
Yes, a lot of those that are on that list are things that I'm aware of but have not personally done. But if you go to my website, I am currently actively seeking out every case study, every research report that I can find on all of these diseases and organizing it on my website.
Okay, and once again, that's drweyrich.com.
Yes, drweyrich.
All right, we got another call. Let's get back to the phone. Good morning, caller. You're on Rim Country Forum with Dr. Weyrich.
Good morning. This is so interesting to me. I have a question. I get a Vivitrol shot every month for alcoholism.
Yes. And
I'm hearing all these things. I also, before I got the shot part, they gave me naltrexone, the pills. So this is so interesting to me that it does all these other things. I really thought it was just for that or for opiate addiction kind of thing. But I'm going to have to look your website up because this is so interesting that it does all these other things, too. That's beneficial.
Yes. So for the listeners, Vivitrol is an injection form of high-dose naltrexone that is used to help with alcohol cravings. And if you're on one of the high-dose naltrexone protocols, then you can't also do the low-dose naltrexone. But
what's considered the high dose?
That would be the 50 to 200 milligrams
50 to
a day.
200, okay. And that was kind of a standard, it looks like.
That's what the FDA approved. Yes.
Okay. And that's also approved for a variety of medical conditions?
Well, no. Here's the deal. The FDA has three basic stances that they can take towards a drug. It can approve the drug if a manufacturer provides them with enough double-blind, placebo-controlled studies for a particular disease. And in this case, opiate and alcohol misuse disorders are what the FDA approved it for. The next step down is they don't have an opinion on it. They say if a doctor thinks it's useful and can document some rationale, then go ahead and prescribe it, but we're not recommending it. And that's called prescribing off-label.
Okay, and she was prescribed, originally you were prescribed the 50 to 200 milligrams of naltrexone?
Yes.
Okay.
According to the approved use by the FDA.
Yes.
And so that would be in conflict. The low dose would not be available.
Well, if you have your body loaded up with the high dose, then the low dose is just going to be a drop in the ocean, so to speak.
Okay, yeah. Oh, wow. Okay, I'm so glad I called, and this was so informative for me. Thank you so much.
Yeah, thanks for calling.
Good luck.
Okay, Bye.
Rim Country Forum with naturopathic medical doctor, Dr. Weyrich, practicing here in Payson on Main Street. You people remember, I think you were over there on the 260 with Dr. Gear. Now you've got a new location.
Yes, I'm next to the fire station now, although we're eyeing an upgrade to our location sometime in the future, so I'm not necessarily pushing my location as much as say, give me a call, I'll make an appointment, I'll meet you someplace.
And you're also available for telephone consultation.
Yes.
Well, that's fantastic. I'm sure that'll be popular.
Yeah, there's some limit to what I can do over the phone, but I can certainly listen to your history and say, yes, I think I can help you, but I've got to get you in front of me, and I've got to take your blood pressure, poke and prod, and do what doctors are required by law to do in person before I can do anything further, like actually making a prescription.
But some things people would just want to know if it's even appropriate, I would imagine.
Right. And then my hope is that after I've established a doctor-patient relationship, and, for example, you're on low-dose naltrexone, we can have some of our meetings over the phone more convenient for both of us. And if it's just, okay, how you doing? Sounds like you're doing good. Let's increase the dose now. Or sounds like we need to back off on the dose or change the dose in some way or whatever. A lot of that management can be done over the phone after I establish the doctor-patient relationship by an in-person meeting.
And you're also practicing in Scottsdale?
Correct.
I see. Okay. Well, that sounds like you're well available then.
Yes, I try to be.
Okay.
So let me finish a thought that I had talking about the off-label prescribing. So that's done very commonly. One of the most famous drugs that's prescribed off-label is Neurontin or gabapentin. So Neurontin or gabapentin was approved by the FDA to treat epilepsy or seizure disorders, but only about 10% of all prescriptions nowadays for Neurontin are for seizure disorders. 90% of it is to treat neuropathic pain, and it's totally off-label for that. But that's what all the doctors do these days.
I'll be darned. So it's proven itself effective for that.
Yes, even though it's not approved by the FDA.
A stupid question, I guess. First of all, the drug manufacturer may not need to, if they're selling enough of the drug for whatever off-label use, then they don't want to spend all the money to have it tested for
especially if it's
label use,
especially if it's generic now.
If it's already available generically, they've got no cost or no profit margin.
Right.
See. Okay.
But one of the restrictions is the drug company can't actually say it's good for neuropathic pain. I can say it as a doctor to my patient, but
and to other doctors and so on.
But the drug company itself cannot say, hey, take Neurontin, it's great for neuropathic pain.
Until they prove it to the FDA with their study.
Which they can't afford to do.
Gotcha. Okay. We've got a call. Let's get to the phone. All right. Caller, you're up on Rim Country Forum with Dr. Weyrich.
Good morning, guys.
Morning.
Hey, I just wanted to, this is a great show, by the way, make a comment on your C-naltrexone. My wife is a downwinder, if you're familiar with that term.
I'm not familiar with it. Is that the same thing as long hauler?
No, the downwinders up here in northern Arizona back in the late 50s, early 60s, they did the nuclear test in Nevada. Okay, and if you're in the downwind zone.
Yes, I got that.
Okay, so anyways, 12 years ago, she was diagnosed with a glioblastoma, the same thing that took out John McCain.
Yes.
And we had her in barrows. They operated on her, couldn't get it done. It was on her brain stem. They started the chemo. They did this and that, and it just turned her into. She was wasted. And we, long story short, we met a super talented naturopathic MD in Mesa at that time, Jason Porter, and he put her on a whole regimen of things. But one of them was your C-naltrexone. And it was, if I remember right, we had to go to a compounding pharmacy to get it done.
Yes.
Anyways, and he did the vitamin C intravenous. He did a whole bunch of stuff.
Yes.
Long story short, going to her oncologist and her MRIs, they're going, by golly, this thing's shrinking.
Right.
And we don't know what you're doing, but keep on doing it. And they're all patting each other on the back and everything. She goes, well, I'm seeing a naturopathic MD. And they just going, oh, okay, well, what do you take? And then Oh, there's just a bunch of different stuff like that. But long story short, I just wanted to say it as a testimonial. They gave her 14 months, and then she just popped right out of it. She went from a wheelchair to a walker to a cane, and now she's just up and cruising. That was 12 years ago.
Right.
Wow.
And it's still under control.
Yes.
And we don't. I'm sorry.
What kind of dosages was she taking?
She was. I'd have to go. Like I said, it was 12 years ago, but I'm wanting to say that she was like on a lower dose.
Yeah. If it's compounded, the only reason to compound it would be to get a low dose.
So the compounding pharmacy can make it specific for that patient in the dose recommended.
Right, but you know what? They shut down, and so I just don't know of hardly any compounding pharmacies around.
Well, I know of some that will compound the naltrexone, and so C-naltrexone actually is short for compounded naltrexone, which I'm sure is low-dose naltrexone.
Right. Well, like I say, Naturopathic MD and the regimen that he had her on saved her life, and we're grateful. So, yeah, it's a good thing, man.
Well, that's pretty amazing.
Yeah, it is.
Amazing story. Well, thanks for your call.
You bet.
You're listening to Rim Country Forum. We're visiting with naturopathic medical doctor, Dr. Weyrich. You can call 888-391-0414 for more information or telephone consultation or appointment. And he's accepting new patients. You could find out more at drweyrich.com. That's drweyrich.com. We got another call. Let's answer another question, Dr. Weyrich.
Yes, let's go for it.
All right, back to the phones. Caller, you're up with Dr. Weyrich on Rim Country Forum. Thanks for your call.
Yeah, this is Frank. Hey, you keep referring to the FDA.
Yes.
Is this the same FDA that approved thalidomide and called the COVID vaccine safe and effective?
It is. So take their advice with a grain of salt. But as a naturopathic medical doctor or any healthcare professional, I have to pay attention to what they tell me I cannot do if I want to stay a free man. So
I'm just poking fun at the FDA. Their recommendations don't mean a lot to me. I actually knew a lady that was a resulting baby from the thalidomide days.
And thalidomide is back, by the way. It's been repurposed. They've got, I can't remember the current indications, but they're selling thalidomide again for, I think, as an anti-cancer agent or something. I'm not sure. It's not something I was interested in, but it is back. Another good example is a drug called Vioxx, which was kind of like a super aspirin. It was what's called a COX-2 inhibitor, and it was on the market for about a year, and they noticed deaths. Statistically, deaths went up by about 100,000 a year that was attributed to Vioxx, and so they ripped it back off the market. But certainly that's one of the reasons why I like the old drugs, the generics that have been around a while, and we've had time to figure out whether they're really safe or not.
I imagine that you find a lot of your patients are very happy to find naturopathic options versus the pharmaceutical options. I think maybe a lot of people feel like they're a guinea pig,
right,
with trying a bunch of concoctions.
But let me say this for the record. If I have a patient that's currently being treated by a conventional medical doctor for long COVID or for cancer or for anything else, I'm not going to tell them stop that treatment. I'm going to say, let's add the low-dose naltrexone. Let's see what happens. And if you improve, then work with the other prescriber to back off on the conventional meds rather than just say, stop doing that. I've got all the answer here. Nah, that's not good medicine.
I'm sure you'll need an idea what they're taking and their medical history and all that information and use that. We've got another call.
Oh, fantastic.
All right, let's get back to the phone. Caller, you're up with Dr. Weyrich.
Yes, I was wondering if you can shed any light on Lyme disease. My sister, South Dakota, she's been diagnosed with Lyme disease 2 years ago. All the Western medicine doctors just said, take a antibiotic and go home. Well, it's brought her right down to her knees. It's affected every organ, her brain, everything. She has Bell's palsy. She's just a mess, and I feel so so sorry for her because she was such an outgoing and had a great job and everything. Do you see anything going forward? Can you suggest anything? She is going to a naturopathic doctor that did diagnose her and gave her a bunch of tinctures and everything. And she said that she's parasite-free, but it's done major damage on her organs and neurological.
Right. Again, low-dose naltrexone has evidence that it is beneficial to Lyme patients.
Well, that's one of their things they suffer is the chronic fatigue, muscle pain, and things that this has shown effectiveness.
But it is due to bacteria, not a virus. So it's a little bit different in its mechanism. But still, it's bacteria that are actually parasites inside the cells of the body where it's hard for the immune system to get to. But low-dose naltrexone does benefit that, partially by reducing the neuroinflammation, which is one of the big problems with Lyme disease and many of the other diseases that low-dose naltrexone seems to be beneficial for. So, yes, if she's not already on LDN, she needs to find somebody in her area that can prescribe that.
Okay, I'll suggest that to her. Her son and husband are doing everything they can. They've been everywhere, Mayo Clinic down to Denver, and they just can't seem to do anything for her. So this naturopathic doctor in Rapid City has been doing the best. Anyway, thank you.
Yes.
All right, thanks for your call.
And we're about out of time.
We are.
So let me just remind everybody, give me a call, please, 888-391-0414. Make an appointment or just continue the question and answer that we've been doing here on the radio. Be happy to talk with you. And my website, drweyrich.com or https://drweyrich.com.
Well, Dr. Weyrich, it's been wonderful visiting with you here on Rim Country Forum. I sure hope we get a chance to do it another time.
Fantastic. Love to be back.
All right. Well, I hope you make time on Saturday mornings for me.
Okay.
All right. And thanks for visiting with us on KMOG Payson, translator K277BX Star Valley.
Dr. Weyrich here. If you liked this video, please share with your friends. Like me on YouTube, subscribe to my YouTube channel, and visit my webpage, https://drweyrich.com. Choose the multimedia drop-down option, and you will find additional information about this and many other YouTube videos. Now, I want to turn it over to you. What was the most important thing you learned from this video? What more do you want to know? Let me know by leaving a comment on YouTube, and I will respond. Thanks, and God bless.